attaching the cable to the base unit, it's important that you line up the keyway on the cable to the marking on the base unit. Line them up accurately and simply push it in. These are the various consumables required for operating the gun. We have a filter, inline filter, that connects through the suction. We need to confirm that the red O-rings are in position. This is how the filter attaches to the gun. Simply push that in. This is disposable multi-needle injector head. Once again, it's important to check the red O-ring is in position. This is the 9-needle head. We have an optional 5-needle head as well for different areas. This is the disposable 5 multi-needle head. As you can see, it has 5 needles rather than 9. This is used in areas that, for example, the backs of the hands, or in areas where the skin is hard to reach or fairly delicate tissue. Lure lock adapter to extend the length of the syringe into the gun. Now we have our syringe. We have the Teosyal Redensity I in a 3mm syringe, which we're going to be using today. Attaching the multi-needle injector into the position port. Simply slips in, clicks into the port. It's very important that this blue attachment is left in place. This stabilizes the needles. This small plastic triangular piece is to stabilize the needle. It's important this is not disturbed. The blue attachment, that is removed only after the needle is ready to be injected. Now I'll show how we prepare the syringe and load it into the gun. This is the product, the Teosyal Redensity I, and this is in a 3mm syringe. Remove the rubber stopper. Attach the lure lock adapter. Screw that into the end of the syringe. So we've retracted our syringe plunger cartridge to the rear of the track. You can now place the syringe into the needle. Now the syringe needs to be gently manually primed to fit into the attachment on the gun. That is gently slipped into that position. Now the syringe is in position. It now needs to be locked in place with these screws, and they're gently screwed in until they're firmly holding the barrel of the syringe. The gun is now fully operational, and the last thing to do is remove the blue safety attachment, which is simply removed like that. Now we'll adjust our settings on the screen. The first adjustment is the size of the syringe. Today we're using a 3cc syringe. This is adjusted pushing the syringe icon, and that is adjusted by 3 pressures to a 3cc syringe. The next setting is the depth. Now the depth, the aim is to get the product into the papillary dermis. The ideal setting for most treatments is at 1mm depth. So we'll adjust that. Adjust it down to 1mm. Some areas of the face where the skin is very thin or delicate, you may use a lesser depth, for example 0.8 of a millimeter for under the lower eyelids. The next setting is the dosage. That can be varied accordingly depending on the size of the syringe and the amount of product you want to infuse. Today we're using 30 microliters. The speed setting, today we're using a speed of 4. The speed is indicative of how long the needle is within the skin. The longer is in the skin, the higher the speed. If product is left on the skin, one would increase the speed slightly. The next setting is the vacuum. An average setting is 4. Today we're going to use a 4. If the skin is very delicate or sensitive, one would reduce the vacuum. the intermittent or continuous setting. The normal setting is for intermittent injecting. If one desired to have a continuous dosing, you can change that to continuous. Generally, you'd use an intermittent setting. I'm Dr. Peter Morley, Medical Director of the Ematheni Cosmetic Clinic in Queensland. We're here today to introduce the V2 injector and the Beauty Booster protocol using Teosyal Redensity I. Our plan today for the treatment is to treat her whole face. We will divide it into 3 sections, upper, mid and lower face. Now the 3 ml syringe has, at that dosage that we've chosen, allows us approximately 100 shots, and we will divide that into 3. Now, Belinda's skin is showing some early signs of sun damage and aging. The slight crepiness in the lower lids, for example, is a perfect example for improvement with the beauty boosting. Beauty boosting will also enhance her texture and just general condition of her skin. The settings of the machine are duplicated on the handpiece, which allows me to keep control of how many shots I'm administering. We're dividing our treatment into 3 regions of the face. At the settings we've chosen, a 3 ml syringe, a dosing of 30 microliters gives us approximately 100 shots, which allows 33 shots for each region. We will start in the mid face, work laterally inwards. So we'll activate the gun. Now it's ready to fire. It will say ready. Now just to confirm our settings, we've got a depth of 1 millimeter and a dose of 30 microliters. We'll start in the mid face, and we'll start laterally to get her adjusted to the treatment. Now the gun attaches to the skin. Just demonstrate the suction. You can see that. Can you feel that suction? So the purpose of that suction, Belinda, is to hold the skin tight against the gun. That reduces the pain and also reduces the amount of potential bruising. Now we pull the trigger and release. And suction. You can test to see that its suction is attached. Pull the trigger once. Listen for the click and release. It's very important to release immediately after the light click. If you leave it too long, the suction will reattach and you will not be able to remove the head. I'll demonstrate that again. Attach, suction, pull the trigger, hear it injecting, click, remove. Now if one is too slow in lifting the head, one can manually dislodge the suction. I'll demonstrate that. Attach, suction, pull the trigger. It's injecting. Now I've left it on too long, you'll see it won't detach. So you can simply break the vacuum and the suction and lift off gently. We'll do it correctly this time. Attach, pull the trigger, click, release. Pull the trigger, release. Another tip to remember is when you squeeze the trigger, to just squeeze it once. Don't hold your finger on the trigger, because sustained holding pressure on the trigger can damage the motor. So just simply pull the trigger, release. What we're seeing, the appearance of the skin is ideal. The product has diffused well into the skin. What we don't want to see is beads of product on the surface of the skin. If that is the case, you can increase the duration of the speed, and that will allow more infusion into the skin. As you'll see, there's very minimal bleeding. If you can just gently swab. The amount of edema that we're seeing is temporary, and that will resolve by the end of the treatment. We're now going to change the depth to 0.8 as we're going to treat under the lower eyelids. Now, under the lower lids, the skin is a lot thinner, so that's why we reduce the dose and reduce the depth. If this patient has very thin, delicate skin, we would also reduce the vacuum. We'll see how she tolerates this. So this is ideal for this slight crepiness to the lower lids. Just close your eyes. You're supposed to pull the cheek down. Gently attach. Stretch the skin. Make sure you have good attachment. It's important it is the one area that may be prone to edema or slight bruising. So therefore, you need to take care, and that's reiterate adjustment of the depth, dosing and vacuum as needed. Make sure you have good suction. What we're seeing here is minimal amount of blood. This is ideal. If one is seeing an excessive amount of blood, indicates you're probably going too deep, so you can reduce your depth. It also indicates you're more than likely not getting the product into the papillary dermis and going too deep. What we're seeing here is ideal. We're going to go in the lower eyelids on the left-hand side. We'll adjust our depth. Okay. Treating the lower eyelids, we've adjusted our depth and our dose, and that is because the skin is a lot thinner on the lower eyelids. Possibly we would adjust the vacuum in a patient who has thinner skin than Belinda. do the forehead now. As you can see, Belinda is tolerating this very well. However, this is a lot of injections to inflict on a patient, so to make it more comfortable for the patient, a good suggestion is to allow the patient to listen to some music. Having a smaller dosage means more injections. So generally for a full face treatment, 100 needles is pretty much what a patient would tolerate. Any more than that, they may be developing a bit of needle fatigue. And we can see there's a little bit of a droplet on the product. That is not ideal. If that was persistent, either we would increase the speed, allow a longer administration into the skin, or possibly increase the vacuum. But it may also be due that my attachment wasn't ideal. Check the vacuum, check there's good attachment, inject. On the forehead, since the skin is a little bit thicker, you could easily increase the vacuum to 5. I'll show you that. We generally get a slightly better attachment. The nature of the vacuum is that it starts at the bottom of the needle square. So a good tip to get a better vacuum attachment is to roll the head onto the skin starting at the bottom half, such as this. I'll demonstrate that. So we have good vacuum, inject, release. Demonstrate that again. Roll it on. Now we'll move to the lower face. The upper lip can be a fairly painful area. Good tip is to stretch the skin, get the patient to put their tongue between the teeth and the lip to allow stretching the skin. If you can do that, just stretch your skin with the tongue, that's good. And just glance along the vermilion border. Until on the gun we have 86 shots completed. That gives us approximately 14 more shots. However, generally there's a bit more than that. I'll show a good tip to improve product placement along the jawline is to retract the skin upwards and place the needle head just under the jawline. On the surface of the chin, some patients have small spider veins on the surface of the chin, and therefore you can reduce the vacuum. In her case, she's pretty good, but we'll demonstrate that. We'll reduce the vacuum to 3. Increase the vacuum. This way. come along under the jawline. Nearly done. We've completed our treatment. We've finished the syringe. It is ideal to stop treatment when it's visible that the syringe is finished rather than persevering, as you may put strain on the motor of the gun. Push it into standby and that switches off the machine. What we're seeing is the ideal post effect: minimal bruising, virtually no bruising, slight edema. These slight bumps in the skin will be gone in 20 minutes. Now we'll cleanse the skin with the Teosyal post-procedure aftercare fluid. Lauren will do that. So the ideal protocol is to follow this up with a total of 3 treatments, approximately a month apart. And what we're going to see is a nice hydration, plumping of the skin, just improvement in the general texture of the skin. As you saw with that dosing of 30 microliters, her skin absorbed that product really nicely. It's indicative of a slightly dehydrated skin. She's going to get a really nice result and see a really nice, healthy glow to her skin. We've completed our treatment and Lauren is applying the Oxygenetics Breathable Foundation to Belinda's skin. As you can see, Belinda looks great. She's ready to go home, and this is the post-procedure, the Teosyal post-procedure kit that she is supplied with.